Good afternoon, everyone, and welcome back to Novatek's Got 15 webinar series. We are continuing our conversation on part 2 of Novatek's new disease control and hygiene monitoring software. Today's session will be looking at monitoring people. As always, the presenters today are myself, Nisa Barkat, Associate Marketing Director at Novatek International for close to 10 years. And along with me on the line, I have my great colleague, Shiva Zaman. Hi, Shiva. How are you doing today?
Very well, Nisa. How are you?
I'm very well too. Thank you very much for asking.
So I am Novatek's Head of Product Specialist and Training Services, and I've been at the company for a little over 19 years and really looking forward to our webinar today. Thank you, Nisa.
Thank you, Shiva. Right before we start, I'll just review some quick housekeeping reminders. All webinars in our series are 15 minutes or less. We know you have a lot on your plate these days, so we hope you'll be able to benefit from these short, straight to the fact webinars. As always, we do encourage your feedback and questions, so please submit them in the chat and we'll be sure to reply to them individually via email. By default, all the microphones for participants are muted. And last but not least, at the end of our webinar today, you will get a link to the recording for all the people who have registered for the series. So without further ado, let's continue this great discussion in a very important topic that is in our world today. In response to the novel coronavirus COVID-19, Novatek Medical Data Systems introduces disease control and hygiene monitoring software. Our most important message is this software is for reducing risk and saving patient lives and protecting frontline healthcare workers through better data collection, analysis, and reporting. A quick review on Novatek International Medical Data Systems. We have over 20 years of life science and healthcare experience with a focus on contamination control and mental health. As recalled from before, the outbreak that we're facing right now is not a one-time event. The disease continues its rampage through the world, and cases have significantly increased since our last webinar back in June. So the need for better control is probably the most important attribute that we're all trying to achieve. Public institutions such as hospitals, clinics, and elderly care facilities continue to pose and be at high risk. I will now pass it on to Shiva to review the disease control and hygiene monitoring workflow that Novatek has presented for this software system. Thanks, Shiva.
Thank you, Nisa. So as Nisa introduced, Novatek is talking about a software solution for disease control and hygiene monitoring, which we like to call DCH. And I'll review a quick workflow of that application. So first of all, we have early warning and detection through thermal screening. So in other words, there can be thermal cameras placed at entrances of hospitals in order to detect both traffic count and people walking in with an elevated temperature. We did a 15-minute webinar on that in the past, so if you'd like, you can click on the link in the description box below to access that and watch that webinar. We also provide control through data collection and monitoring, and that's in 3 areas. So that is rooms, people, so personnel, which we'll talk about today, as well as critical equipment such as HVAC systems. The lovely thing about the software is that we're able to have early detection and early identification of the potential source of the contamination. So through the analysis of the system, we will be able to do some root cause analysis and try to figure out where that contamination is coming from and how to stop it. Now, today I'll be talking specifically about the source of contamination with regards to people, and in the following webinars with regards to locations and equipment. So the fact that this data is available in real time and paperlessly, it allows decision makers to respond in a timely manner. So there is the ability to have a rapid response to any potential outbreaks. We're able to both prevent and contain. Prevent by identifying potential sources of contamination and root causes in order to address them and prevent recurrence in the future, as well as containment with early detection in order to put processes into place to contain and control a potential outbreak. And as data gets added into the system over time, it has the ability to do predictive analysis, which may really be beneficial in the future. So there's 4 key high-risk areas that DCH looks at and DCH handles. So the first one is monitoring of entrances, it's early detection, and it's with those thermal cameras that we were talking about. That webinar is available now on demand, and the link is in the description below. But that is with cameras placed at all the entrances, and the software will automatically detect people walking in with fevers and higher than traffic counts. And the user may then set limits for alerts and actions if there's an above normal level of people walking in with a fever or higher than normal traffic count. And you know, that's a new technology that we're seeing in other places. I know I'm in Los Angeles, and LAX here now has, you know, thermal screening in their Tom Bradley terminal. So that's something we're seeing more and more, and the Novatek software will automatically link to that with little to no human interaction. So humans are really just being notified when those levels are reached, but there's a little work to be done on their end for that monitoring. So on today, actually, we're going to go look through how DCH monitors people and what information it gives you there, both for the cleaning effectiveness of PPEs as well as just gowning procedures. So on August 6th, we'll be looking at monitoring of locations, monitoring of rooms, and that may be through routine sampling that you may already be doing, such as swabs, dip slides, contact plates, sponges, and how the software can monitor and prevent proliferation in common areas such as emergency rooms, and how, you know, when and if an outbreak occurs early, how we can detect the source of the contamination or analyze and assess the root cause. And then finally, on August 13, we'll be looking at monitoring equipment and critical equipment such as HVAC systems, monitoring of environmental conditions such as temperature and humidity, as well as critical utilities such as water. So in order to monitor all of these 4 high-risk areas, one of the key areas is people, which is critical, as people have the ability to spread pathogens. They have the ability to spread viruses and whatnot to, you know, other visitors, to patients, to other staff, etc. So it's really important that that be monitored in an efficient manner. So DCH does that in 2 ways. And the first is that it schedules the monitoring of personnel. So you can strategically organize it to be post-gowning, post-training, post-cleaning of PPE components that may be reused in order to verify the efficacy of a training, the efficacy of a gowning, the efficacy of cleaning, etc. So, and you know, obviously you can set that up to be monitored at regular intervals as well. And then we will graph the results. So we will put them on maps, we will put them in graphs to allow for comparisons and to allow for looking at which variable might have come into play, whether that is issues with one particular, let's say, disinfectant, whether it's an issue with training of a specific person, etc. So you can compare that data in order to deal with it appropriately. So one thing that we do have when we're mapping is we have 3 levels when we're detecting pathogens. So one is within acceptable limits, one is an alert, and the final one is when action is required. So those are limits that are set up by you, by the user, And they can be set up over time as you're looking at that data and you're looking at, what is within a certain standard deviation in order to assess what those limits should be. So as you can see in hour one, the dots in the sampling that has been done on that person is green and all within limits. Whereas as time goes by, you are seeing alerts and you are seeing actions on that personnel. So you can help use graphing that results to determine effectiveness of cleaning or gowning. So if you are seeing results in a particular area, that may speak to the gowning procedure. If it is just on a component of the PPE, it may speak to the cleaning effectiveness. So there's a lot that you can look at just by visually mapping the personnel and to help avoid proliferation. So here you can see on the graph, we have trended results for 3 different people. And what that tells you is if you see high results with one particular person, it would become immediately obvious. And then you would know that you may require retraining for one particular individual. You may identify the source of contamination, trace back to one specific individual, and may do tracing of that individual's activities. So all data can be trended in a linear regression. It can be trended in bar charts, line graphs, control charts. So we just have that example of a linear regression, but you can look at the same data in various different formats. So on this graph, we're looking at a line graph, and we know that cleaning was conducted on March 23rd. And as you can see, the results drastically went down after that cleaning. So we do know, and we're able to show graphically and with our data, that the cleaning was effective. You can use similar graphs to look at training, to look at other types of qualifications. Perhaps if you're looking at different disinfectants and want to look at the cleaning effectiveness of that, you can always graph the results pre and post cleaning or training or gowning on a similar graph. So just overall, the benefits of monitoring people, we've talked about how personnel is really a high risk for spreading the virus, and they can, prevent doing so, but with good gowning procedures and good cleaning procedures. The lovely thing about DCH is that it's risk-based monitoring. So you're really maximizing your effort to monitor people. You're doing so strategically, and the software helps you strategically plan what sampling you do so that every effort into monitoring is well used and is giving you good data and knowledge regarding your process in your facility. It really streamlines, when and how samples are taken, and because it's paperless in real time, and having real-time notifications, you're really able to detect early and keep your personnel and patients safe. So the other thing it does with its trending is identify patterns. So for example, as you can compare staff, you can compare people, you can right away help assess root cause, you can right away justify your cleaning procedure and show that it's effective through that trending. When there is an issue, it's easy to drill down to problem areas and potential variables that may have caused an outbreak, and look at things like gowning and degowning protocols, looking at PPE cleaning protocols, or components of PPEs or different disinfectants or anything that may have affected that outbreak. So in terms of detecting root cause, it's really important into being able to prevent and address those root causes in order to prevent potential outbreaks and keep those people and patients safe. And finally, with that early detection, addressing those root cause areas can really help you make decisions in terms of new training for your personnel, adjusting cleaning agents, adjusting cleaning protocols, and keeping your personnel and patients safe.
Shiva, I can't thank you enough for continuing this really important discussion for the new disease control and hygiene monitoring software. Part 2 was very important. We can't stress enough the importance of the continued need for data collection and, of course, what that means in terms of how to trend and analyze it for better early warning detection. So thank you for that. As a reminder, everyone, here is a quick synopsis of our future webinar dates. Again, today we looked at monitoring people. On Thursday, August 6th, we will continue the conversation where Shiva will discuss the components of how to monitor rooms with the disease control and hygiene monitoring software. And then last but not least, on Thursday, August 13th, our part 4 and final part of our webinar series will be on how to monitor equipment and critical utilities. A small reminder, part 1, monitoring entrances is available on demand, and we can't thank everyone enough for their time today. Again, please take note of our contact information below. Both Shiva and I welcome your feedback, your comments, your questions, and of course, if you'd like to see a more detailed demonstration of Novatek's disease control monitoring software, DCH, please do contact us and we can have that arranged. Thanks again, everyone, for joining the GOT15 webinar series. You are well under time, so we hope that we'll respect everyone's schedule these days, and we look forward to seeing you on August 6th for part 3, how to use DCH to monitor rooms. Shiva, thanks again for your time today.
Thank you, Nisa. Thanks, everyone.